Impetigo is basically a highly contagious superficial bacterial skin infection, and it is very common in neonates and children, and may be associated with conditions such as scabies, eczema, lice infestation, and herpes simplex infections as secondary infection. This condition does not cause any symptoms until 4 to 10 days after initial exposure. It usually improves within a week of treatment, and there are two types of impetigo: the non-bullous type, which typically affects the skin around the nose and mouth, causing lesions to develop, and it quickly bursts and leaves a yellow-brown crust. The other type is the bullous impetigo, and it typically affects the trunk, causing fluid-filled blisters as a bullae to develop, and these bullae burst as after a few days to leave a yellow crust. Both types of impetigo may leave behind marks when the crusts have cleared up, but these usually improve over the few days as the following days or weeks. And its prevention involves good hygiene, regular hand washing, trimming of fingernails to reduce breaking of the skin through scratching, and also discouraging the sharing of towels and clothing. Main causes are Staphylococcus aureus and Staphylococcus pyogenes. The symptoms are pus-filled blisters and sores on the body or scalp. The signs that are usually elicited are superficial, fragile, and fluid-filled blisters, and irregular spreading ulcers with yellow crusts. And investigations are microscopy and culture of exudates from blisters, except in recurrent or severe cases. Often, no tests are required. The main treatment objectives are to eradicate infection, to prevent transmission, to reduce the risk of developing complications, for example, cellulitis and septicemia, and also to identify and treat any predisposing conditions. Non-pharmacological treatment, antiseptic baths for all cases. The main pharmacological treatments for mild cases, that's few pustules without fever or systemic manifestations, you give mupirocin ointment, that's topical. In adults and children, you apply 12 hourly for 7 days. For moderate to severe or extensive cases of in patients without penicillin allergy, first line treatment, you give cloxacillin IV. So you give 500 milligrams 6 hourly for 3 to 5 days, and in children 10 to 18 years, you give 250 to 500 milligrams 6 hourly for 3 to 5 days. And 2 to 10 years, you give 125 to 250 milligrams 6 hourly for 3 to 5 days. Less than 2 years, you give 26.5 to 125 milligrams 6 hourly for 3 to 5 days. And then you add flucloxacillin oral in adults 500 milligrams 6 hourly for 5 to 7 days, and in children 10 to 18 years, you give 250 to 500 milligrams 6 hourly for 5 to 7 days, and 2 to 10 years, you give 125 to 250 milligrams 6 hourly for 5 to 7 days. Or less than 2 years, you give 62.5 to 125 milligrams 6 hourly for 5 to 7 days. Or you can give amoxicillin clavulanic acid oral. So the combination in adults, you give 625 milligrams 12 hourly for 5 to 7 days, and in children 11 to 18 years, 625 milligrams 12 hourly for 5 to 7 days, and 6 to 10 years, 457 milligrams 12 hourly for 5 to 7 days. 1 to 5 years, 228 milligrams 12 hourly for 5 to 7 days. Less than 1 year, 114 milligrams 12 hourly for 5 to 7 days. Second line treatment, you give Cefuroxime IV in adults 750 milligrams 8 hourly for 3 to 5 days. In children 1 month to 18 years, we give 20 milligrams per kilogram 8 hourly for 3 to 5 days. And then you give furosemide oral in adults 250 milligrams 12 hourly, and in children 12 to 18 years, give 250 milligrams 12 hourly. Then 2 to 12 years, give 15 milligrams per kilogram 12 hourly, with a maximum dosage of 250 milligrams 12 hourly. And 3 months to 2 years, give 10 milligrams per kilogram with a maximum of 125 milligrams 12 hourly. Moderate to severe or extensive cases in patients with penicillin allergy, you give azithromycin oral in adults 500 milligrams daily for 3 to 5 days, and in children 10 milligrams per kilogram body weight daily for 3 days. Less than 6 months is not recommended because of the risk of pyloric stenosis. So referral criteria: refer for hospital care and treatment if spreading rapidly, or cellulitis or osteomyelitis, or even septicemia develops.